And also, Ann, I would just like to say my email address is K, F as in Frank, AIRLEY at nrcdv.org.
Thanks, Kenya. So, Mary Louise, start us off.
You're on mute, Mary Louise.
Thank you, Ann and Kenya. I'm sorry, I was on mute for a minute there. Thanks for the introduction, Ann, and Kenya's email is also there in the public chat for anybody who would like to reach out for those materials. I'd like to thank everyone for joining us today, and welcome to this webinar, Enhancing Safe Access to Child Support. Here at the Administration for Children and Families, the Office of Child Support Enforcement, and my office, the Family Violence Prevention and Services Program, or FVPSA program as I may call it. We are here partnering to highlight the collaboration opportunities for domestic violence organizations and local and state child support agencies. We're very pleased that Vicki Turetsky, Commissioner of the Office of Child Support Enforcement, and her colleagues has joined us today to talk about why ensuring safe access to child support is so important. Then Ann Menard, who you've heard from previously, the CEO of the National Resource Center on Domestic Violence, will also join to provide an overview of domestic violence resources produced collaboratively with the Office of Child Support Enforcement, including fact sheets, desk cards, and online training materials to promote safe access to child support. And before we jump into hearing from Commissioner Turetsky, I'd like to just state for a moment, for those who may not be familiar with the FVPSA program, on the occasion of the 30th anniversary of the passing of the Family Violence Prevention and Services Act on October 9th. Just want to give a quick overview of some of the work that is being done across this country through the FVPSA program, which supports local domestic violence programs around this country. Over 1,600 shelters and 1,100 non-residential service programs are supported through FVPSA. And the program also supports domestic violence coalitions in every state and territory to provide training and technical assistance to local domestic violence programs. Many of these coalitions have established really meaningful partnerships with child support agencies and worked collaboratively to ensure that survivors can access child support as well as stay connected to critical advocacy services that they need. The FVPSA program also supports national resource centers and a national domestic violence hotline that provide training and technical assistance to advocates, service providers, community members, and universities on preventing and addressing dating violence and domestic violence. And today you'll hear from one of those resource centers when Ann Menard talks about the work that she's done that's been so instrumental in not only facilitating partnerships between child support programs and domestic violence advocates, but also in developing those really valuable tools that are used by child support agencies. But we also recognize that while over 1.3 million people may be served through domestic violence programs during a year, that many victims of domestic violence will never come to a domestic violence program. And it's equally critical that if they walk into a Head Start center or a child support agency or a TANF office, that they get the support they need. And so one of our primary initiatives is to promote efforts to help ensure that every Health and Human Service agency has the capacity to recognize domestic violence and the impact it has on the families they serve, to respond appropriately, and to make referrals and have partnerships with community-based domestic violence programs who can help support those victims when needed. During this 90-minute session, you'll hear directly from Vicki Turetsky from the Office of Child Support Enforcement and Michael Hayes, whom she'll introduce. And this is one example of one of the critically important places where victims of domestic violence may be speaking with people who, if really well informed and connected, can create that vital link to domestic violence services and supports. Although it's not a replacement for other forms of financial assistance, child support plays a critical role in the lives of many single mother families, including victims of domestic violence. And research tells us that regular and adequate child support payments for every child are critically important to the health and well-being of the children. And most single parents, as we know, headed by women, live just above, at, or slightly below poverty levels. So some key facts linking those parents who may come to child support agencies and domestic violence. We know that lack of economic stability is a primary reason that victims of domestic violence stay in or return to an abusive relationship. In one study, 50% of abused women stayed because they did not feel they could support themselves and their children. We also know that regardless of whether they are victims of domestic violence, most public assistance clients want child support. Abused women resemble non-abused women in that they share the same aspirations for education, work, and financial independence. And we also know it's particularly important that domestic violence victims have access to information about the benefits and risks of child support enforcement, how the system works, and how they might access that support safely. This has been a long-term partnership. We've been working with the Office of Child Support Enforcement for several years and have watched with admiration the way that they've worked very hard to build relationships between local offices and domestic violence coalitions and programs. In fact, we were looking back and found that 3 years ago we co-hosted a webinar during Domestic Violence Awareness Month very similar to this, talking about safely pursuing child support, and 150 participants dialed in then to learn about the importance of domestic violence training for child support enforcement workers. Well, since then, I have to say, I have great respect for the work that the Office of Child Support Enforcement has done to move beyond sharing resources and one-time training sessions. I think they really stand as a beacon in the Administration for Children and Families as a program that has really institutionalized effective responses to domestic violence across child support agency practices. You will hear more about that. So we are extremely proud of the partnership that we share with OCSE and the partnerships that are forming and strengthening between local agencies and domestic violence coalitions. I want to commend the work that's been done by many of the National Resource Centers on Domestic Violence and partner resource centers, including the National Council of Juvenile and Family Court Judges, Battered Women's Justice Project, and the National Resource Center that Ann will represent. The last 30 years have really yielded some amazing accomplishments in the domestic violence field, and it would not have been possible without the meaningful partnerships that happen in communities around this country. I'd like to invite you to refer to the FVPSA program's website and to learn more about all of the programs and services that we support and to access information on domestic violence programs and services around this country. And now I'd like to turn and introduce more formally Vicki Turetsky, Commissioner of the Office of Child Support Enforcement. As Commissioner, her priorities include implementing family-centered strategies to support parental employment and involvement, modernizing federal and state technology to increase program efficiency, and expanding the Tribal Child Support Program, as well as preparing for generational change. Ms. Turetsky brings more than 30 years of experience as a public administrator and advocate for low-income families. She's a nationally recognized expert in family policy and is instrumental in efforts to boost child support payments to families and establish realistic child support policies that encourage fathers to work and play an active parenting role. Vicki?
Well, thank you, Mary Louise. Your support and your ability to bring us all together and encourage our agency, the Administration for Children and Families, to use Domestic Violence Awareness Month as a galvanizing event has really been inspirational to us, and we appreciate your support. You've been a great colleague here at ACF. We are really grateful for your leadership and commitment to this really vital issue that's of importance to everyone on the phone and everyone in our room. What I'd like to do today is spend about 15 to 20 minutes reviewing the topics that we have here on the slide and really showing you what some of our resources look like in concrete terms so that you know when you go to our website what to look for, what's available, and what you can use and adapt. To start with, in terms of our resources, I want to introduce Michael Hayes, our Domestic Violence Coordinator. And Michael, would you just say a few words? Just shout out hi so they hear you on the phone.
Hi everybody, it's been really wonderful to see all the different people who are introducing themselves on the public chat, and it's a really nice mix. It seems to be a really nice mix of both child support enforcement staff and representatives from family violence coalitions, and I even see some friends of mine from different family violence coalitions. So welcome to the welcome to the webinar.
Well, thank you. We are really excited to see the different people with different jobs and the number of people on the phone with a focus on domestic violence and advocacy around domestic violence. We're do we need to take additional polling, or do we have all of our polling results?
I think the poll is just now open, Vicki, so give people a chance to answer the poll online, then we'll get their results.
That's great, and then we'll know precisely who is in the audience. So it looks like we have really a great mix of all the players that need to be working together to make a difference for families around the issues of child support where there's a risk of violence. I trust that you can see that on your slides, but it looks pretty evenly distributed among child support program managers and administrators, frontline staff, domestic violence state coalition staff, domestic violence managers, frontline staff, and federal agency staff. So thank you very much for joining us. We've got just the right people in the room. Let me give you a brief overview of child support from I guess I'll say a functional perspective. Congress has given us the job to work among the federal, state, and tribal child support agencies to establish paternity, legal parenthood, set child support orders which establish the amount of child support owed, obtain child support payments, and transfer them to families, transfer them from the parent living apart from a child to the child's household, to provide access to health care coverage, and you may not know that we have the job of ensuring that every child in our caseload has health care coverage, and connecting parents to support services. We pay 66% of the cost at the federal level, so states chip in a third and we pay 2/3 of child support costs. This is an infographic that we have on our website. It provides some basic data about the child support program. While the child support program was initially implemented as a cost recovery program, meaning reimbursing then AFDC costs and Medicaid costs, it has steadily moved away from that reimbursement role to the public treasury and instead focused on providing money going to families. And specifically, and to be clear, because this has changed over time, 95% of the dollars we collect are going to families. There is a residual that still is used as welfare cost recovery, but very little money left in the system where that happens. And what this means is that more than half of the income of poverty-level single-parent families who are receiving child support is child support. Child support is the second largest source of income for families next to the mother's own earnings. So mothers and fathers together are providing most of the support for their children when they're at the poverty level. And when that child support does not come in, or it's unavailable for one reason or another, families need to resort to public assistance. I say this because child support is a big deal in terms of economic security. We serve 1 in 4 kids and deliver one of the largest sources of income support for them. The child support program around the country is shifting to what we call a family-centered model of child support. And this really, in a nutshell, is a set of policies and practices and services that puts family in the center of our work. Now, we're only halfway through this shift, so I'll be the first to confess that practice is uneven around the country as states move forward to implement a more holistic model than has existed in the past. Whereas we started with the job given to us by Congress of cost recovery and then began to shift to providing income to families, we're now taking that road to move further towards the vision of providing linkages and services to families that complement that income support that we provide through our collection efforts. So our challenge here is to both provide those enforcement services and then also to provide the kinds of services that will help support families, both parents, and help reduce conflict and do the best job we can that's possible for the kids that are living in families where the parents are living apart from one another. Specifically, family-centered strategies implies accurate child support orders based on real income, individualized case management, dealing with the differences among families and family circumstances in different ways. If a family has enough money to go around, if they don't need services, if the parents are stably employed, we use one set of strategies. If we have an actively evading parent who's running to hide assets, we use a different kind of strategy. If we have a violent partner, we use a different strategy. And in all cases, we're trying to keep our focus on the needs of the children and the needs of both parents. As Mary Louise said, child support can play a critical role in financial independence. It is that largest income support for a poor family's budget next to the mom's own earnings or the custodial parent's own earnings. But we know that child support is a two-edged sword. Everybody on this call understands that while child support provides a major source of financial support and financial independence for families, it also can increase the risk of violence. Both establishment, getting that order in place, and enforcement actions have the potential to trigger increased violence. And yet, as Mary Louise referred to, 90% of survivors want to pursue child support if they can do so safely and confidentially. So that leaves us in a very clear position of needing to understand domestic violence in our program, to put safeguards in our program, and to provide those service linkages around domestic violence. We take to heart the reality that many survivors return or don't leave an abusive partner due to financial dependence. And so that's our core function. And yet we know that filing for child support may be one way a survivor says to the perpetrator, "I'm not coming back, this is it," and holds that perpetrator accountable. And this is where the link between child support and domestic violence comes into sharpest focus. by providing safe and meaningful opportunities to disclose domestic violence, by implementing comprehensive safeguards throughout all child support processes, by clearly communicating in a family-centered way, communicating to each parent, to each woman, that this is what the process looks like, and these are what the safeguards are and what they aren't, and by engaging in ongoing collaborations with family violence service providers and coalitions. We can be a part of helping provide that safety net and can put family safety and economic justice at the forefront of our work. OCSE and child support programs at the state level and now tribal level have a long history of working with families who've experienced violence. But because child support is administered by states and tribes, there are variations in the range of responses at the local program level. At a minimum, all states have policies and procedures in place for flagging cases with family violence. And we do that through a computer indicator, a family violence indicator put on our systems, both at the state level and the federal level. And this indicator blocks the survivor's address and other contact information from being disclosed. Most all states have procedures in place for increased safety procedures and personnel in court settings when family violence has been disclosed. And likewise, most states have developed resources to educate survivors about safety options when pursuing child support, as well as procedures to make referrals to community resources. The combination of address confidentiality, safety procedures, educating survivors, and community referrals create what we call a yellow light approach for survivors in the child support system. Most recently, a number of states have enhanced this yellow light approach by adopting comprehensive family violence policies and plans developed in collaboration with state or national domestic violence experts, expanding the training requirements for child support staff to promote greater understanding and skills both at a general level and a specialized level, increasing options for disclosure of safety concerns, developing extensive outreach and education resources for survivors as well as the advocates working with survivors, partnering with local domestic violence service providers to house legal advocates in child support courtrooms, and implementing legal practice training and standards that emphasize the state's interest in safe, workable child support orders and enforcement practices. Now let me talk about parenting time, because our mission is to serve the child, and the only way we can serve the child effectively is by working with parents. And that has brought us over time pretty squarely to the issue of parenting time. We're looking at the intersection of parenting time and domestic violence. With existing access and visitation programs, which we administer, we provide the funding for each state to provide grants to local access and visitation programs. The Office of Child Support Enforcement has required states to include safety planning and family violence policies in their administration of the access and visitation program and in subgrants to the local organizations. We've relied closely on expert input from domestic violence partners as we've looked ahead to the broader incorporation of parenting time into child support orders, something that Congress is interested in, something that is reflected in the administration's budget, and something that many children growing up as adults say they need that access to their parents. In the short term, we're testing strong domestic violence procedures as part of the parenting time pilot that we're funding. And I will say here that we've shifted our view a bit. We came into our domestic violence parenting time pilots with a real focus on minimizing risk, putting safeguards in place, making sure that the business of parenting time establishment was not increasing safety risk for parents. But you know, one thing we've discovered anecdotally, and the research is still to come in, but we've discovered that actually the Parenting Time child support programs can be a portal for services to domestic violence survivors. In other words, we're not just trying to prevent harm, but what we're seeing the potential for is actually providing one more gateway for parents to openly express their concerns or confidentially, to have a place to take the concerns and the risks that they're facing and get connected to professional expert domestic violence services. And more than one survivor has thanked us in a Parenting Time pilot for that open opportunity to change her life and her safety risks. So we're very excited about the potential, but we need to learn much more. We're moving very slowly, and at every step along the way, we are consulting with experts, with domestic violence coordinators in each site. Now, we have recently issued a new information memorandum in support of Domestic Violence Awareness Month. And this is part of a series of memoranda that not only our office, but offices across ACF have issued to raise awareness of domestic violence. And for this and many other things, we have FVPSA and Mary Louise to thank for her really fine coordination and ability to galvanize all of the programs in this direction. So this is a picture of our memorandum, and it highlights the tools for state, tribal, and local child support programs to help parents safely and confidentially obtain child support. And this particular information memorandum emphasizes the need for, as well as the opportunities for, collaboration. And this is on our website. With that background in mind, and with our commitment to supporting these expanded approaches to the yellow light child support work, which is one way that family-centered services plays out, providing the services that parents need in a particular case, yellow light child support work, I wanted to jump right into the existing child support resources on domestic violence. We have a family violence page on our website with many resources, primarily links to national and state domestic violence organizations and think tanks. Another useful link is the second one on that family violence page on how to contact a state, local, or tribal child support program. We also have some very specific publications. We have a caseworker desk card and a judicial bench card to provide some very basic information about child support and domestic violence. We also have on our website a guide for trainers on safely pursuing child support, a set of training tools there. And we have a parent pocket card that tells parents very clearly you have the right to be safe, and provides some very specific information that we think survivors will benefit from. We understand that the core of child support's work around domestic violence has to hard bake in collaboration with programs that address domestic violence, as well as fatherhood and child welfare. Working with all three of these collaborations in concert can reduce violence, increase economic resources, increase parent involvement, and improve child support outcomes. Therefore, collaboration really has been a hallmark of child support activities in the domestic violence arena. Here at OCSE, our work on domestic violence has been informed by our collaboration with multiple domestic violence organizations and experts, and the National Resource Center is key among them. Many state and local child support programs have established strong collaborations with their domestic violence organization counterparts as well, working with the statewide coalitions and local programs. This OCSE fact sheet on our website, there's the bubble chart, which is our little picture of family-centered services, highlights several of these successful collaborations. 3 key lessons that continue to rise to the surface in these collaborations between child support agencies and domestic violence organizations is, number 1, the need for child support agencies to listen to the perspectives and concerns of domestic violence organizations. Also for domestic violence organizations to learn about the child support processes, have accurate information that can be conveyed to parents. And to recognize that the intersections of child support and family violence means that there quite often are not simple or easy solutions. So you know, how to both provide family income and yet assure family safety and domestic violence prevention requires creativity and flexibility and really individualized, tailored responses. For example, perhaps payroll withholding doesn't, the mother, the domestic violence survivor doesn't think payroll withholding is going to cause a trigger for violence. But perhaps suspending a driver's license or taking a boat or revoking a hunting license is going to be a trigger. And so tailoring a response to avoid and minimize triggers and yet focus on getting money to families, that's where we try to be with these collaborations. And as these collaborations really mature, and this is really the ultimate lesson, the trust and understandings are built in, and the big wins generally come after years of working together. It doesn't come easy, it doesn't come overnight, and we want to make sure that those collaborations have time to really become second nature. So this leads me to my final comments about collaboration. And first I want to take a poll. I want to know who on the phone has worked in collaboration with other partners. I suspect that most of you have formed collaborations and partnerships in a variety of ways. So I'm waiting for the poll results here. I think what we're interested in is knowing, who is working in a child support program and has a strong collaboration with the domestic violence program or coalition, and who on the domestic violence coalition or program side is working already with the child support program. I think as poll numbers come in, we'll share them, and here they are. I just saw them there. So we see about 15% of people working in child support have a strong collaboration with the domestic violence program, and another 10% are starting that collaboration. And we see, pretty similar numbers, on the reciprocal side. Many successful partnerships and activities may be funded with child support funds. I want to draw your attention to a policy guidance, again, on our website. Just go to our website. It's called PIQ 1202, Fed speak for a particular type of policy guidance, which answers questions from state and tribal child support programs. And that guidance is called Partnering with Other Programs, Including Outreach, Referral, and Case Management Activities. That guidance is worth looking at because it has specific examples of allowable activities, meaning we'll help pay for it, 2/3 of the cost. This PIQ, this policy guidance, expressly addresses domestic violence referrals and outreach and says the following. Federal child support funds may be used to provide information about family violence and to screen and make effective referrals to emergency shelters and family violence services, including advocacy and counseling services for families in the child support caseload. Federal funds may be used to develop, produce, disseminate, and present outreach and education materials and curricula about safe access to child support services. Federal funds may be used for consultation with community-based domestic violence experts, and it's often very useful. We encourage grantees, meaning child support programs, to hold consultation with experts in the field of domestic violence. And the guidance says to create domestic violence units that include trained caseworkers to provide specialized child support services that are domestic violence informed is another allowable activity, something that the federal government will help pay for. Let me say a few things about confidentiality, although we know that this is a deep issue. We know that confidentiality is a key concern, and our office recommends ongoing review of existing state and tribal agency and court confidentiality policies. Federal child support funds can be used to develop alternative address and confidentiality systems for survivors in the child support program. This may be in partnership with family violence service organizations. Apart from data sharing, where there are safety concerns, child support professionals must be careful not to communicate any information about child support customers unless required by law. At the same time, even where child support programs pay careful attention to safety needs of families, there will always be risks to engaging with the child support system. I mean, we understand we can't bring the risk to zero, but we also understand that we can do a lot to maintain confidentiality and improve safety. Therefore, it's important not to promise total safety or confidentiality, particularly given the prevalence of information on the Internet. So we recommend ongoing review of existing confidentiality policies in concert with domestic violence coalition and program partnerships to determine where the vulnerabilities are, to tighten it as much as possible, to educate the court, and to provide parents with accurate information about what they can expect from the system. Now, as we move forward, here is a set of things that we want to see in the program, and we are beginning to see, we're seeing more of in the program. We want to review and update domestic violence policies and practices, really taking into account what we understand about domestic violence and what we are being told by domestic violence experts today, as opposed to those conversations taking place 20 years ago. We need to develop new policies and procedures that reflect modern families, modern systems, and modern knowledge about what works and what doesn't work. We expect state flexibility. Everything we do in partnership with state and tribal child support programs. It is states and tribes that are responsible for administering programs and making judgments about how to allocate resources, and we defer to that. That is their job, and we look to states and tribes for the expertise that they have in informing our policies. Now, Medicaid expansion under the Affordable Care Act is an important opportunity to develop policies and practices that promote safety for survivors who are newly eligible for Medicaid. And I say that because we have an interface with Medicaid that is longstanding, that is starting to develop and shift, And we are receiving new families into our caseload as a result of that interface. We have the job of providing health care for all of the kids in our caseload, 1 in 4 kids in this country. And what we hope to do is, over time, reconfigure the child support program so the parents, too, can receive referrals to health care services and policies. A comprehensive domestic violence plan that a state might put together with its flexibility would address disclosure, training, confidentiality, referrals, and internal procedures, and staffing for responding to domestic violence. Several states have requested guidance from us regarding Medicaid referrals resulting from the single streamlined application completed by applicants for medical insurance through Healthcare Marketplace. Federal policy regarding Medicaid referrals to child support agencies has not changed, but Medicaid expansion and the marketplace application process mean that child support programs in some states may receive more Medicaid referrals overall, and in particular may receive more inappropriate referrals. Referrals may be inappropriate because the case referred doesn't actually include a custodial parent with a child support eligible child, or the referral doesn't include sufficient information to identify a non-custodial parent, so there's nowhere we can go with that case, or the domestic violence is present, but the parent did not have an appropriate opportunity to claim good cause and otherwise identify safety risks. So those are all impacts to our program and things that, state and tribal child support programs need to configure our services to respond to adequately. Finally, child support expects to issue more guidance on this domestic violence policy and practices and advise state and local child support programs to consult with your local domestic violence agencies or your statewide domestic violence coalitions as you're updating your domestic violence protocols. Providing enhanced support to survivors of domestic violence is a part and parcel of family-centered approaches and will benefit families while improving child support compliance. Thank you very much for taking a look at our resources. And now let me turn it over to Ann Menard and introduce my old friend and colleague for 20 years or so. Ann is an activist who's worked on policy, practice, and research issues affecting domestic violence and sexual assault survivors since the 1970s. And what a distance we've come since then. Her particular focus has been on survivor-defined advocacy and public policy and research affecting women and their families, especially those living in poverty. And that is a very nice fit with family-centered approaches because that's what we're talking about, working with families. So she brings great expertise. After serving as a senior consultant to the Family Violence Prevention and Services Program at the U.S. Department of Health and Human Services, my department, and this was in 2005, she then returned as director of the National Resource Center on Domestic Violence, a position that she held. So she was there at the National Resource Center, then she came to the federal government, and then she returned to the National Resource Center. Prior to that work, Ms. Menard led the Connecticut Coalition Against Domestic Violence for over 6 years, and in the early 1980s, co-directed Connecticut's largest domestic violence shelter and has been actively involved in grassroots sexual assault advocacy. So you are truly listening to an expert and an ally and one of the premier leaders of the domestic violence community. Ann?
Thank you, Vicki. And I want to thank you, Vicki, for your critical leadership at this important intersection of child support and domestic violence. And I also want to add my thanks to Mary Louise Kelly and her colleagues at the Family Violence Prevention and Services Program for their work in building such robust partnerships across the federal government to strengthen our response to domestic violence in so many of the systems and programs that survivors reach out for help and protection. So thanks to both of you for your leadership. The child support program, as Vicki clearly described, is an important resource for domestic violence survivors, but only when they're able to pursue child support safely. I've been asked, my role here is very focused, and I'm going to do this fairly quickly because we've had some great questions posed, some of which are actually addressed quite nicely in the training materials that I'm going to focus. So I've been asked to highlight in more detail some of the training resources that have been developed specifically for child support agencies and their domestic violence agency partners to support this goal of enhancing safe access to child support. Each of these training resources draws heavily from actual practice in the field, and we're grateful for the generosity of many child support agencies and domestic violence coalitions, some of whom are on the webinar today, as well as some of our national domestic violence partners for their assistance in developing these resources. I want to first start by pulling up again one of Vicki's slides, which underscores that many actions that the child support system takes to establish and enforce child support orders, whether from paternity establishment to court hearings to sending wage withholding orders to a non-custodial parent's employer, have the potential to trigger increased violence. That's why we're having this conversation. This slide also reminds us, though, that the overwhelming majority of survivors want to pursue child support. Research and experience really bear that out. But the key here is that they need to be able to pursue child support safely. So a critical message stressed in all of the training materials and resources I'm going to very quickly highlight is providing safe and meaningful opportunities to disclose domestic violence by implementing comprehensive safeguards throughout all child support processes, paying attention to communicating safeguards and their limitations to victims, and by engaging in ongoing collaborations with family violence service providers and coalitions, so that the child support process can indeed be a source of financial support for custodial parents and their children. So the first resource I want to highlight for you, and again, if you have not picked up the website address, it's going to appear on the last slide. So one of the things that you will find there is a document that provides a very quick overview of the types of materials that are available on the Office of Child Support website. Describes the training resources, again, which I'm going to highlight. So this is a one-page document that you can share with your colleagues to say we should be checking out these resources, make sure that people are aware that these exist. The first of these resources is a 36-slide PowerPoint along with trainer's notes, which has been designed so that child support trainers without extensive domestic violence expertise can conduct the training for their staff. If the training is being provided with collaboratively with domestic violence partner, which is a practice we highly stress and support, the training PowerPoint will also help domestic violence experts with less familiarity with the child support process. So we had both of those training partners in mind when we developed the training webinar, the set of slides. It also recognized that one of the reasons that we developed these materials is in recognition that particularly over the last 5 to 6 years, both domestic violence and child support agencies have been affected by tightening state budgets, and in some cases lost trainers or even whole training departments. So we wanted that not to be a barrier to continuing to provide training across this important intersection. So I've just pulled out 3 or I think 4 or so of the slides that are part of this slideshow. Here you have a slide which shows the 2 main training areas that this slideshow covers. What is domestic and family violence? Why is it important? And also, what is this notion of safely pursuing child support, or what Vicki referred to earlier as a yellow light approach? And then here's I think the last slide that I pulled out. We've certainly learned in our training over the years that folks get stuck in all sorts of interesting, in some cases very understandable places, and the training then helps people get unstuck from those places and really learn how they can be helpful to survivors who are seeking support from the child support system. The headlines of the three main headlines from the training are here. We want people to understand that most domestic violence victims want to pursue child support if they can do so safely, that domestic violence issues can come up at any point in the child support process, and in order for survivors to do good safety planning, they need accurate and complete information about the child support process. So again, these are just a set of slides that from that slide show that's available on the child support website. In addition to that slideshow, which is available for you to incorporate and adapt in your training, there's also a set of training notes that for each slide, that includes for each slide detailed talking points and tips, training tips that suggest how you can ensure that the information that is included is best presented and reinforcing of other messages throughout the slideshow. So again, these are two important and related resources. Another resource that was developed along with the training PowerPoint is a caseworker desk guide. This is something that is formatted in such a way that it's easy to copy in the office or print professionally. Some offices we know have produced laminated copies. This is a two-page resource that helps caseworkers, particularly those who may not deal with domestic violence issues on a regular basis and want some quick reinforcement or reference to make sure that they are responding using recommended practice and covering all the important aspects of a good response. So the desk card includes information on, again, the intersection, defining domestic violence, some key points about understanding victims, what makes disclosing domestic violence difficult for some victims, and then probably most importantly, lists some promising practices for safely pursuing child support. The kinds of preparation there should be in place if there is a disclosure of immediate danger. Again, bullet points on confidentiality, safeguarding information communication. So again, it's a quick reference that's meant to reinforce, to supplement, and then reinforce the messages that are included in the PowerPoint. Another resource for child support agencies is a modifiable outreach card, again, based on some great work that's been done down in Texas and Massachusetts and some other states that have taken up this role of making sure that folks that are coming into their offices seeking services understand the kinds of domestic violence-related safeguards that are in place and the kinds of accommodations that can be requested by survivors who have safety concerns. So again, this is another resource that's available. It's called You Have a Right to Be Safe, and it's available in both Spanish and English. And again, is modifiable in a sense that it allows you to insert local resources and to services or contexts within the community that might be helpful to survivors. In addition, there is a domestic violence and child support bench card, which was developed with the input from our colleagues at the National Council of Juvenile and Family Court Judges, their Family Violence Department. And again, it provides information for those involved in the judicial process on recommended courtroom safeguards for pursuing child support when domestic violence is present. So again, another resource, not on the Office of Child Support website, but another resource that is available through our website, vonet.org, is an online learning tool that really covers the basic of domestic violence. It's not specifically directed to child support agencies, but is a useful supplement for those interested in understanding more broadly domestic violence, its impact on individuals and communities, and the roles that we can all play in our both professional and personal lives to respond to domestic violence and be helpful to survivors who are seeking help. And the last thing I wanted to do before opening it up for some questions is reinforcing, again, the slide about collaboration and how important that is to this process of really enhancing safe access to child support. One of the resources that you'll also find on the website is a webinar that was recorded that includes several of child support agencies around the country talking about the collaborations that they have built with their local domestic violence partners, and it provides, and how they are implementing these strategies and practices related to enhancing access to child support for survivors of domestic violence. So I also commend that resource for you as well. So at this point, we were a little bit of time, but why don't we take a few questions? There's been a number of great questions posed. Again, some of the questions that have been posed relate to information that is covered, I think, quite nicely in some or all of the training resources that I've just quickly reviewed. But Kenya, do you want to pull out one or two questions that we can pose to the presenters before we close out the webinar?
And Kenya, this is Michael. I just want to make sure that people have my email address. So if there are questions related to the child support program that you'd like me to follow up with that we can't get covered in today's webinar, people can email me. So I've put it into the public chat, but for those of you who maybe aren't able to see on the public chat, my email address, it's Michael, M-I-C-H-A-E-L .Hayes, H-A-Y-E-S, and that is at acf.hhs.gov.
And Michael, I'm posting that as well in the public chat for those of you that didn't write that down. So Kenya, do you want to pull out one or two questions? Kenya, did we miss you?
Well, Ann, this is Michael. How about I just answer one that I saw in the public chat?
Absolutely, great.
So I saw a question that I believe Emily asked early on about the some of the state child support programs that are doing debt compromise, and if consideration of domestic violence on a case comes into play there. I do know that in at least some, is somebody else trying to get on? Okay. So I'm not sure how states are treating debt compromise and domestic violence in their programs. But I think that's a great question. It's prompting me to think I need to find out more information about that very specific thing. I do know that there are states that in their negotiation process the state itself will take the position where a victim of violence may be being intimidated or manipulated by a perpetrator for that victim to forgive a certain portion of child support or maybe not ask for a certain amount of retroactive child support. I know that there are jurisdictions where the state takes a position that they will oppose forgiveness of those arrears or forgiveness of a certain portion of the retroactive order if they believe that the victim is being manipulated or threatened in such a way that for them to do that. And the state will communicate that it is the state's decision, not the victim's decision, to forgive or not forgive that, so that the state becomes the bad guy. And that's not to forgive old debt necessarily, but that can often be done in the initial negotiation process when a victim may be willing to forgive a certain amount of retroactive child support. But that's just an example of a yellow light approach in which the state can find out from the victim what might trigger more violence or increase the manipulation or the intimidation from the perpetrator, and the state play kind of a buffer role.
Thanks, Michael. This is Ann. I'm going to pose one last question. I know we're over time, but I just indicated, I have to send this. Michael, I'm committing you and I to take a close look at again, there were lots of very specific and general questions that were posed in the chat, which raise a lot of important issues. So we'll take a look at those and figure out a way to get additional information out to the webinar participants for any of the questions that we're not able to address here. So, Michael, are you game to do that with me?
I am game. I'm more than game.
We will do that. But in closing, I'd like to pose a question to Vicki and Mary Louise, which is, what is the most important idea or learning you want participants to take away from today's webinar?
Mary Louise?
Well, I would say that I think most importantly I would like people to consider that safety is primary, but that shouldn't stop us in our tracks and keep us from pursuing child support for the benefit of the families we serve. So these kinds of partnerships I think are critical to making it possible to do both.
And I guess I would say as advocates think about child support, don't think yes, no. Think how. And then sit down and figure out with the survivor you're working with the program, how to make child support income available safely, or whether, but think about tailoring.
Great, thanks. Mary Louise, do you want to?
Sure. Thank you.
Last comment?
Sure. All right. Just to say thank you to everyone for taking the time to be part of this webinar. It's critically important. We all know that for victims of domestic violence, the question of how will I support my kids is often very primary in their minds when they make decisions about where to go next. And I really think the practical tools and guidelines and resources and great policy that have come out of the Office of Child Support Enforcement help to make child support enforcement agencies a welcoming and important gateway for victims of domestic violence to get help. Thank you to Ann Menard for your presentation today, for your years of work on making human services more responsive to victims of domestic violence. And I want to thank both you and Michael Hayes for taking on the next steps of following up with the questions and resources that people have requested on the webinar. And to all of the staff at the National Resource Center on Domestic Violence for supporting this webinar. Thank you very much, and to Shondell Dawson here in our office. Thank you all.
Thank you, everybody.
Take care.